And with us now, two doctors on the front lines, Dr. Nicole Gilg from the primary care clinic at Broadlawns Medical Center in Des Moines, Iowa, and Dr. Craig Spencer, an ER doctor and the director of global health emergency medicine at Columbia University Medical Center here in New York. Good morning to both of you. And Dr. Gilg, I have to start with you. In Iowa, your state, the cases there have gone up 77% in just the last couple of weeks. How overwhelmed are folks in your state? How worrisome is this?
It's very, very busy and certainly a critical time. We have been managing so far, but everybody is very concerned because we continue to see the case counts, and we know that we are just starting to see the effects of case counts from 2 weeks ago, which is why when we say that right now we're already at a breaking point, we're very concerned about where it's going to go from here.
Yeah, I was reading, you spoke to our producer and you said you guys watched the case counts. We all watch the case counts, but as physicians and nurses and first responders, you look at the case counts and you know in a couple weeks, a certain number of those are coming to you.
Yeah, absolutely. We're trying to do the best that we can do in terms of planning, but what we're finding is that it's so unpredictable. So we try to take examples from what happened in New York City at the beginning of the pandemic and other areas, but it's just a really different situation this time. We have more testing, which is wonderful, but the downside to that is that then it's a big load on our outpatient clinics, which means we have less staffing to pull from.
Dr. Spencer, you were there in the ER in the springtime, in the early days of the pandemic when New York City was hit so hard. What is the feeling right now? Are you nervous that we may be seeing another big surge in the city's hospitals now?
Yeah, absolutely. Everyone is worried, and we've all been worried that, cases were going to increase. As everybody knows, New York City really went through the worst of this in March and in April. And over the summer, we were able to largely control the spread here. But over the past few weeks, we have seen an increase in the number of cases and hospitalizations. Even anyone just walking outside the testing clinics throughout New York City will see that the lines have grown significantly in the past few weeks. So we're all quite worried and we're all quite prepared. In New York City, we have the experience, and many of us have a lot of experience taking care of COVID patients. And so in that sense, we're ready. But many of us are still mentally exhausted from what we saw, what we did, from the colleagues that we lost in March and in April. And so there is an ominous feeling for many of us here that we're going to have to go through some measure of what we've already gone through once before.
Yeah, and Dr. Gilg, there was so much talk in those early days about PPE and the lack of supplies, and that's still a concern. But the most precious supply is our doctors and our nurses. And some are burned out, some are sick. I've read many, many instances of healthcare resources, personnel resources really being put under a tremendous amount of strain.
Absolutely. I think the biggest concern is, where are those cases coming from? Are they happening within the healthcare system, meaning that maybe there are breaches in our PPE protocols? Are they happening outside simply just because the prevalence is so high? But it's another worry on top of the worries we already have.
Yeah. Real quickly, Dr. Gilg, you said something that was so striking to me. When you look around and you see people not wearing masks or making Thanksgiving plans when they really shouldn't, you said you feel like you're putting out fires at the hospital, and then you go out and see people still setting fires.
Yeah, I appreciate that we are all tired. I know the public is tired as well. None of us want to be in this situation, but the hospitals are full. And so we need to look at what is the most preventable of what is filling the hospitals. And right now, that does seem to be COVID-19. At this point, there's not a lot you can do about a heart attack if someone's going to have one tomorrow. But certainly, we do think this is a preventable disease and that the mitigation strategies work.
And I'll let you have the last word, Dr. Spencer, your message quickly to folks who may be thinking about heading out for Thanksgiving or tired of wearing the mask. And man, we're all tired of wearing it. Nobody more tired than all of you working on the front lines.
Absolutely. We all want to see our family. I have a 2-year-old that hasn't seen her grandparents in a long time. We know that there's an end in sight. We can get back to base camp, we can get back to safety, but we're going to have to climb Everest first. The next few weeks, the next few months are going to be really difficult. And quite honestly, there's just no foolproof way to make a visit to your family over the holidays zero risk. So we're just encouraging everyone to stay home if you can, do virtual this year, because we all want to see you in person next year.
Thank you for your work, Dr. Gilg and Dr. Spencer. We really appreciate your time.